My name is Michelle Noble. I am the director for the Autry Radiography Program. Welcome to your virtual radiography observation day. Normally, you would spend about 6 hours at St. Mary's following technologists and students, watching what they do in a typical day. This observation would help you decide if a career in radiography is for you. Since this is not possible, I've compiled a couple of videos and pictures to give you an idea of what a radiographer does. So you want to be a radiographer. As you watch the following video and navigate through the presentation, I would like for you to ask yourself the following questions. Do I work well under pressure? Do I like to help others? Am I self-motivated and eager to learn new things?
So you're interested in becoming an X-ray tech. An X-ray tech or X-ray technologist is sometimes called a radiographer. They may also be called radiologic technologists, a rad tech, an X-ray technologist, or an X-ray technician. All of these titles refer to someone who is professionally trained to take X-rays and perform other X-ray-based diagnostic imaging procedures within the medical field. So what exactly do radiographers do? A radiographer creates images of inside the human body. This is a very dynamic and high-demand profession. Radiographers work in urgent cares. They may work in emergency rooms. Some radiographers work in surgical departments and also all through the hospital, performing X-rays with portable machines. Radiographers can also be found within doctors' offices and chiropractor offices. Radiographers may even travel to people's homes and care facilities to perform X-ray imaging. Radiographers are trained to capture images of just about every part of the human body. Some of the most common radiographs performed are on the chest, the abdomen, and of the extremities, like the hands and the feet. Radiographers are also trained to perform a special kind of imaging called fluoroscopy. This is sometimes called dynamic imaging. This is real-time images that are acquired when the patient is being examined by a doctor. Fluoroscopy procedures may include drinking special dyes or injection with special dyes. Radiography is actually one of many types of different imaging professions. Many radiographers also get training to perform computed tomography or magnetic resonance imaging, abbreviated MRI. Others may get trained to perform mammography, which is X-ray imaging of the breast. Some radiographers continue on to get training in sonography, that's the same as ultrasound. Some radiographers may get trained in what we call nuclear medicine. Together, these different types of imaging disciplines and many more are called diagnostic imaging or medical imaging. As a general radiographer, also called an RT, you can work in several different settings. About 70% of all radiographers work in hospitals, 20% work in small clinics, and the remaining 10% work in private offices like doctors' offices and chiropractor offices. Another type of radiographer is a limited radiographer called an LMRT or sometimes LXMO. They do not usually work in hospitals due to state regulations. Instead, a limited radiographer usually works in imaging centers, doctors' offices, or chiropractors' offices. So how do you become a general radiographer? You have to complete an accredited program. General radiographers require about 2 years of specific radiography training. You'll usually earn an associate's degree or a bachelor's degree by the end of the program. Limited radiography programs are different. They require only 1 year of training, and by the end you'll earn a certificate, not usually a degree. These programs offer training in specific areas of radiography, but not everything. You may learn to perform radiography on one body section, like the chest, but not the entire body. So as a student in either of these programs, here's what you'll learn. You'll learn how to communicate with patients. You'll also learn how to position patients for X-ray procedures. You'll learn how to operate an X-ray machine, and you'll learn how to work as a team with other medical professionals. A really big part of radiography school is what we call clinicals. This is where you take what you've learned in the classroom and put it to practice on real patients at hospitals or imaging clinics. You'll work side by side with licensed radiographers every day, And eventually, you'll have to complete evaluations or competencies on the most common exams to prove that you're actually capable of doing the job of a radiographer. The last step in becoming a radiographer is passing the National Certification Exam in Radiography. This exam is about 200 questions on everything that you've learned in school. Most radiography programs provide some type of prep course or prep courses to get you ready for the registry certification exam. There's also other resources available, like preparatory books, as well as online programs and online message boards that students commonly use to help each other get ready for the certification exam. So you need one more reason to look into radiography as a career. The U.S. Bureau of Labor Statistics estimates that medical imaging will grow by 9% over the next 10 years. That means many job opportunities are available in this dynamic career. So if you like helping people, you like working in a team, and you want to be in a healthcare setting, radiography might be the right profession for you.
Autry does not offer the limited X-ray license as described in the video. Upon graduation from our JCERT accredited program, you will be eligible to sit for the ARRT National Registry and begin your career as a registered radiologic technologist. The most common X-ray is the chest X-ray. It is the first examination you will learn to perform. Chest X-rays can be done in the department in examination rooms or done with mobile X-ray machinery in patient rooms, surgery, the emergency room, or ICU. Other examinations require you to be up close and personal with patients. This image is from a barium enema, where liquid barium is used to fill the colon. As a radiography student, you will be required to participate in a variety of examinations. Some are definitely more pleasant than others. Sometimes our patients are badly injured and in a lot of pain. Not all patients are easy. You must be able to remain calm and work well in pressure situations. The following video is a reenactment of an observation day for a potential radiography student. Watch closely. I'll be asking you some questions after the video.
So hi Chelsea, I'm Dinah. I'm a clinical instructor for Lake Superior College, and today you're going to have a shadow experience with us. And I thought first of all I'd like to start out by showing you the schedule for once you get into the program. But could you tell me first of all, like, whereabouts are you in the program as far as getting in, or are you hoping to get in soon?
Yep, I'm just finishing up my prerequisites, so I'm hoping to apply to get into the fall.
This fall. Okay, great. All right, so once that happens, I got to also ask you, do you work another job right now? Mm-hmm. You do, like full-time, part-time?
Just every other weekend right now.
Every other weekend, perfect, because that's one of the reasons why a lot of our students drop out is when they're working full-time, they come into the X-ray program, and the X-ray program is almost full-time, and then working two full-time things is not going to work for as far as studying and making a good attempt at trying to get the program, you know, under control with studying and stuff like that. Mm-hmm. So anyways, I'm just going to show this to you how it kind of goes so you know. When you start in the fall, you are in the didactic portion up at the college for 8 weeks first. You go to school 2 days a week. Okay, they block schedule a few classes, patient care and a few others. You got to get those done before you can come into the clinical setting. Then once you come into the clinical setting, you will only be in class on Mondays. And then the rest of the 4 days that week, Monday or Tuesday, Wednesday, Thursday, Friday, those 4 days you're in clinicals for 7 hours. It's roughly about 29 hours. They're 7.5 hour days. And so then when you're in clinicals that long, that's 29 hours plus the 6 or 8 hours that you're in class on Mondays. Do you see how that's like a full work week? Mm-hmm. So working every other weekend works out perfect, and that's what the students succeed best at. And then when it comes to spring, you'll also be working some afternoon shifts. And so for fall, it's just days. We actually have a shift here at Essentia where you start at 5:30 a.m. because you do portables. And so that's an early one. But, and we have fluoroscopy, general radiography rotation. You have portable rotation, transport, you go with the transporter. You have an office rotation where you learn about the office. And then come spring, when you come back for spring semester, you will have PMs, weekends. You also have fluoroscopy again. And then when you have your portable shift, halfway through that portable shift, you'll go up to surgery and you'll get a little experience up in surgery. So today we're going to show you some different exams, hopefully get a general exam and a fluoroscopy exam and possibly trauma. All of our students that come as shadows, they just take off and go with the tech or take off and go with me and just follow us, and we just go, you watch how we do the exams. So, yeah, any questions at all, or no?
No.
All right, are you ready to start? Mm-hmm. All right, it's going to be fun. All right. Hi, are you Brittany?
Yes.
Hi, come on with me. My name is Dinah, and this is Therese. Come on. Okay, I'll have you come take a seat on the chair here.
Okay.
And I'll first of all ask you what your last name is, Brittany.
Hardy,
Okay, and your birth date, please.
8/30/82.
Okay, and it's your right hand that hurts?
It is.
Okay, and is it you're pregnant?
No,
No, okay.
absolutely not.
And I'll have you put your hand on here, but I see you have a ring on, so can you try and get that ring off for us? All right. Yep, we're going to do 3 pictures, a front view, and a kind of halfway side view, and then a complete side view. So I'm going to have you put your arms straight this way. There you go. And I'm going to center to the 3rd metacarpal phalangeal joint. That's what you learned in class. And then we collimate here. Is there any way you can make it as flat as you can? Yep, there you go. Thank you. And then we'll put our right marker on. And I'm going to open that up just a touch more and get a little more wrist. All right, hold real still. Beep. Okay, now I'll have you turn it halfway up. There you go. It's the same centering right there. And then you got to make sure you don't collimate off that thumb there. All right, hold real still. Beep. Okay, and now I'll have you put it all the way on its side. There you go. And can you spread your fingers apart like you're making an okay sign? There you go. Oh, good job. Yep. All right, and just make sure you have that light all the way around. Okay. Beep. Okay, that's done. I'll take the shield from you. We'll bring you back to the ER. I'll have you come with me. So this is a fluoroscopy room. A fluoroscopy room is different than the general room, like the general x-ray that we did earlier, in the fact that that x-ray is done instantly and you see the picture instantly. And here, this is live radiation. What happens is the radiologist comes in and he steps on this foot pedal right here, and you can see how there's an eye and then a camera. That takes the picture, but the eye makes live radiation come on. So as an x-ray student, you'd come in here with the radiologist and you'd get the patient ready for multiple exams that I'm going to tell you about. And the radiologist then would say, you know, to the patient to start drinking the barium or whatever, and he'd push on that pedal, and the x-ray is going to go through the patient's body from beneath, the x-ray tubes down below, goes up into the image intensifier, and then the images show up over here as the patient is drinking and doing the different exams. And one of the tests that you would be a part of in here is a barium swallow test. And barium is mixed into a glass with some water, and barium is an element on the periodic table. If you remember back in the days when you took chemistry, the big periodic table, barium, X-ray cannot get through barium. So that's why we use barium, because it helps show up on X-ray. We have some other things that we can use too, gastrographin, Omnipaque. These are all different contrast mediums that X-ray cannot get through them, so they show up and let us see the patient's anatomy from the inside. So then we also have these gas pills, and these gas pills we give to the patient, and it forms air inside of the patient's belly. So as they drink the barium, they have the air in there, we get a double contrast. One of the unfortunate things that could possibly happen is the patient might get sick and they might throw up, so you got to be ready with a bag here in case they get sick to help them. Here's a picture of what would happen when a patient drinks that barium. As you can see, the patient's starting to drink, it goes down, and the doctor is able to look and see if there's anything going on with their swallowing their epiglottis. Yeah. And then some other tests that we do in here, the one that kind of scares a lot of students, is called a barium enema, okay? Back in my day, we would do 15 of these exams a day, okay? A barium enema is where we take barium, fill it into this bag, and then we have this rectal tip here, and there's KY jelly, and we put the KY jelly on there, and the patient's laying on the table, and we actually insert the rectal tip into the rectum, and then we run this barium into their colon, fills up their colon, and the patient has to, hold it, and we take pictures, and the radiologist is here, and he's taking pictures, watching the barium going into the patient. Probably 3 or 4 you will see in your 2 years in the program. It's not like the olden days. There's things like CAT scans, MRI, things that have replaced this exam, so we don't do it very often anymore. One of the other things that we do that involves barium and instant potato buds, kind of interesting, is we mix the two of them together, and it forms a real thick paste that's like feces. And we fill it into this syringe, and we inject that into the patient's rectum, and it only has to go in a small distance. And then the patient actually sits on like a toilet seat, and the radiation is coming through the patient, and we watch the patient defecate into a bag. Kind of a odd test, but it's actually one that is really helpful in diagnosing if people have prolapsed rectums. So that's why we do it. Another test we do in here is a bladder test called a cystogram. We actually hang this bottle of contrast from the IV pole, and the patient comes to us already catheterized, and then we attach that to the catheter, and we have that go into the patient's bladder until they feel full. The patient tells us they feel full. The radiologist will come in, he pulls that image intensifier across, takes pictures of the patient's bladder. They'll do side views and lateral views, and they're looking for any kind of reflux going up the patient's ureters. And then at the end of that exam, they take out the catheter, and they actually have the patient pee, because they want the patient to urinate right onto the table, because they want to see if there's anything wrong with their urethra. So with all those things, you have the possibility of someone throwing up, you have the possibility of someone letting go of that barium rectally, and then they purposefully defecate for the one test, and then there's urine. So there's all those things, and you have to be okay with that. Sometimes there's smells, but that's what we do in this profession, is we try really hard to help that patient. So we do the best we can to help them through that. One of the other things when you come into the program is we do a lot of injections into patients' joints, in their back, in their shoulders, in their hips. And when I say we, it's not me doing it, it's a radiologist. But there are these bigger needles. This is a 5 centimeter long spinal needle, and when the patient's in here for this exam, if you're doing a shoulder exam, you as a student would prep that patient's shoulder with betadine and get it all cleaned off. We open up a big sterile tray, and then the radiologist comes in, and then he locates the area of the joint where we're going to go, and then he'll put this needle into the patient because it's a needle inside of a needle. So they take out this inner sheath, and then they connect tubing to it, and they inject some of this contrast material into that patient's joint. And then that patient often goes to MRI or even CT, and they can diagnose if the patient has, like torn rotator cuffs, or if they have herniated discs in their back, things like that. And so when you're in this room and this live radiation is going on, you can't be in here with clothes just like this, like we are. We would get radiated. So we have something called lead, and X-ray cannot get through lead. That's why all of our walls are lined with lead. And we have, everybody wears this, not the patient, but us as a technologist and you as a student. So put that on so you can kind of feel how heavy that is.
Wow.
Yeah, you kind of got to walk around with that all day long.
All day?
Yep. Yeah, and we actually have some where it's wrap around and covers you all the way around. We have lead glasses that you wear. The radiologist wears them, the techs, the students, everybody, because we want to protect our eyes. We have thyroid shields that we wear. It covers our thyroid, so we're always protected when we're in doing these exams. And so there's going to be a patient coming in just a little bit, and you'll get to watch. It's a patient that's going to be drinking the barium, and so Colleen's going to do that with a patient, and you'll be able to watch. All right.
Okay.
So come on with me. We'll go find and see if she's ready.
All right, we're going to go out and get our first patient of the morning here. She'll be out in the waiting area. Okay. So what we're going to do is we're going to call her by her first name, not her last name. We'll confirm last name when we get her in through the double doors. It's kind of a HIPAA thing that we want to make sure we call them by their first name, not their last name out here, if we can do that. So, okay. Megan, how are you?
Good, how are you
Okay, good. We're going to have you come on back here. And can I get your last name?
Josephson,
All right, and your date of birth, please.
12/21/90.
Is there any chance you could be pregnant?
Nope.
My name's Colleen, and this is Therese. She's our shadow student today. Are you okay with her being involved a little bit today?
Yeah, that's totally
Okay. So have you ever had any barium studies before?
fine. Nope, I haven't.
Okay. Have you had anything to eat or drink today?
Nope.
Oh, that's all good. So what we're going to do, the first thing is take you to the changing area. And I got a couple things for you here. So the first thing, I need you to change from the waist up. Shirt and bra and necklace.
Okay.
Earrings probably should come off as well, but this goes on first. It's a gown, ties in the back.
Okay.
And then here is another bathrobe, so you're a little more covered up.
Okay.
And your clothes can go in any of the lockers with the key. Lock it up and just put the key on your wrist, and then have a seat right around the corner, and I'll be back to get you.
Perfect. Thank you.
All right, you're welcome. So you go ahead in there and change, and I'll be right back. Okay, all set?
Ready.
Okay, let's go. We're gonna go down to the x-ray room now.
Okay.
And this is right around the corner here. And this is where we're going to perform the x-ray. And this is going to be fluoroscopy, which is like live x-ray.
Okay.
So we can kind of see what's going on.
Okay.
All right, okay, come on in. We're gonna let you take a seat right here. Very good, all right. So Megan, I just have a couple questions for you before we get started, but what we're going to do, your doctors asked us to do a study for your esophagus today and your stomach.
Okay.
How we visualize that is we have two different contrasts. We have barium, it's called. It's a powdered solution we mix with water. You drink it, it shows up on this TV screen. We also have what's little pop rocks. Have you ever had pop rocks
Yeah.
before? Okay. These are very similar to that, kind of like Alka-Seltzer. We mix
Okay.
with a little bit of water. We have you drink those down. Those will put gas in your stomach. So it's kind of like a double contrast where you're going to use barium, which is white and chalky, and the air, which is kind of like a gas. The gas crystals are going to make you want to burp.
Okay.
We don't want you to burp.
Okay.
So how you fight that feeling is you swallow a couple times. Swallowing will help keep that gas down inside where we want it to be.
Okay.
All right. So any questions about that?
Nope.
So the next question, I'm going to do some screening here. Have you had anything to eat or drink? I know I asked you before, but I'm going to ask you again. Okay. Tell me a little bit about your symptoms.
Well, I've been feeling like something's been getting stuck, like right about in here.
Okay.
I feel like, especially when I lay down, something comes right back up.
Okay. How long have you had those symptoms?
Probably about like 3 months or so.
Okay. And is it mostly with liquids or solids?
Liquids.
Liquids. Okay. All right. And solids go down okay? No problem with solids?
Takes a couple times to swallow. but that's
A little
about
bit
it.
with the solids. Okay. And 3 months, you said?
Yep.
All right. Any scopes? Have they gone down and looked with the scope?
Not yet, no.
Okay. So, Therese, on the scope issue, what they like to do is they put a scope down, they can look into the esophagus and the stomach and see if anything is going on. So that's why we always ask. Sometimes they do biopsies. Have you had a biopsy recently?
Nope.
Okay, and that's something we will want to know too. Any surgeries on your esophagus or your stomach?
Nope.
Okay. So the next thing we're going to do then is Denny LeMay, he's going to come in. He's our radiology practitioner here. And what we do to get you started is we have you step up onto this little platform. You can see there's a little platform here.
Okay.
We have you put your back up against the table.
Okay.
At that point, we're going to give you some barium, and we will start with a thicker barium.
Okay.
It coats very well. The crystals will distend out the esophagus, so we will give you some crystals as well.
Okay.
So, any questions about that?
I don't think so.
All
I think
right.
We're good to go.
We'll start upright. At one point, the table will lay back down, so we will do that in 2 different projections. When you're standing up and you drink something, gravity pulls it through.
Okay.
When you lay the table down, now your esophagus actually has to work. So that's why we do it with you standing and with you laying down
Okay.
as well. So any questions, I will get Denny then.
I
So,
think we're good to go.
all right. So Megan, I'd like you to meet Denny.
Hi Megan, how are you?
Good, how are you today?
Colleen's explained everything that we're going to be doing to you here.
Yep.
So we're going to start you off right up on this table.
Okay.
We're going to have you stand on this platform right here and face me, all right?
Okay.
Perfect.
Right. And we're going to get you some barium here. So
Okay.
we're going to go over to the counter here and get some barium. So I'm going to get the barium here and our crystals. What we start with here. All right. So here we go.
All right, I want you to hold this in your left hand.
Okay.
I'll just take those from you.
Crystals? Yep.
So when I tell you to, I want you to take some of that, hold it in your mouth until I tell you to swallow, okay?
Okay.
You look straight ahead. Swallow. Good. Now I'd like your back up against the table. We'll do the same thing from the front. Just take some of that in your mouth, hold it still. Swallow. Good. All right, I'm going to steal that from you for a second.
Okay.
We're going to give you these little crystals here. I want you to down it as soon as I give it to you.
Okay.
Right on down. Perfect. Now we're going to put this in your left hand again. And I want you to turn so you're facing that corner of the room. Perfect. Okay, one swallow, please. Okay, good. Now we're going to have you do that again. I'm going to take a couple pictures as we go. Very good. Very good. Okay, back against the table. Now the table you're laying on is going to recline.
Okay.
It's kind of like a reclining bed. Just kind of relax and everything's going to go backwards here. I'll take that cup from you. Here we go.
Okay. I'm going to give you a pillow here, Megan, okay?
Okay.
So this is going to go behind your head. Just want you to rest back there. And then when we get you down all the way, we're going to give you a little bit different barium. It'll be a thinner barium,
Okay.
okay? Very good.
Okay, what I'd like you to do now is roll over onto your tummy for me. All right, good. I'd like your right arm down by your side. Left knee halfway up the table. Perfect.
Now I'm going to slide this pillow back just a little bit. here.
Okay.
Just put a little cloth there for you. This is our thin barium, so I'm going to have you hang on to the cup. I'm going to put the straw in your mouth.
And when I tell you to, we want just one swallow, all right? Mm-hmm. Okay. All right, take one swallow, please. Okay, good. We'll take that from you. Perfect. Now we're going to have you roll back onto your back. I want your knees up with your feet flat on the table. And when I tell you to, I want you to tighten up your tummy as tight as you can, like you're going to bear down for a bowel movement or someone's going to push on your stomach, okay?
Okay.
Okay, let's have you do that right now. Okay, relax. I'm going to have you roll away from me, about halfway. Good, same thing. Tighten up that tummy as tight as you can. Tight, tight, tight. Okay, good, relax. Now I want you to roll toward me this time. Okay, right there's good. Just tighten up that stomach as tight as you can. Okay, good. Now we're going to have you back on your back, feet down. Okay, just hold on nice and tight. Table's going to stand up now, okay? Here we go.
Okay.
And I will take that pillow from you, Megan. Here, you want to lift up your head. I will grab that out of your way. And then, Therese, we can put that right behind you on that counter there. And then we'll
How you doing?
a little closer.
Need to burp?
Yep,
Go ahead.
that's okay.
All right, one more thing before we get done. You can let go of the table there if you would.
Okay.
Now, I've got a little pill in here. It's about the size of a Tums.
Okay.
I want you to put that in your mouth, follow it down with the water, and we're just going to watch you go. Put your back right up against the table. Good. Okay. Excellent. All done. We'll get you down off that thing. Just relax there for a second. This is going to come down. It's going to sound like a car backing up.
Okay.
And a little bit of a step down
Little
there.
step down.
I'm going to let you have a seat there in the
And I'm going to look at these real quick, and we'll get right back to you here.
Okay, sounds good. Thank you.
You bet.
washcloth here.
Alrighty. Megan, we're all done.
Okay.
Do you have an appointment coming up with your physician soon?
I think next week.
Okay. You'll get the results then, or if you want to find out earlier, then you can call them in a couple of days here and we'll have everything set up for you.
Perfect. Thank
All right,
you
it's
so
nice
much.
meeting you.
Nice
Good luck
meeting
to you.
too.
So Megan, we're all done now.
Okay.
And some post-procedure instructions for you. We want you to push some extra fluids today, water, juice, whatever you like to drink. We need to flush that barium through your system.
Okay.
The first couple BMs that you'll have white barium mixed in
Okay.
with the stool. That's normal. It has to work its way out.
Okay, good
So,
to know.
okay. Other than that, we are all done and you're free to go.
Perfect. Thank you so much.
You're welcome. So Therese will get the door for us here and we will let you head down to the changing area.
Thank you.
You're welcome. You have a good day.
Thank you.
And
You
it's
too.
right around the corner there.
Perfect.
Thank you.
Got a trauma in the ER, you guys. Let's go. Megan and I'll get the portable. You get the grid holder in room 210. All right, we pull the curtain.
X-rays here. Let us know when you guys are ready. Okay. X-ray can come in. We're ready for it.
Doctor, what are we going to need?
We're going to need a chest x-ray and proximal lateral C-spine.
Okay.
We have a 28-year-old female, high-speed motor vehicle crash. She has some neck pain and she has some decreased lung sounds on the left, so I'm a little concerned about the pneumothorax. We've got a 20 gauge on the right hand, forearm,
Megan.
flush as well. X-ray, just let us know when you're ready. We'll get out of here.
You can leave that railing down.
All right. Sorry.
Chelsea, you want to get a technique set up?
Okay, top of my cassette is here.
Okay, come over
I
on
have
this
it
end.
in lengthwise.
Got a heart rate of 59, sats of 99, 100/66 for pressure.
Chelsea, can you grab me the apron? Got a marker?
Yep. I'm gonna lower the bed down.
Okay. You're ready for x-ray?
X-ray.
Beep. Doctor, you want to come look at the x-ray?
Maybe that makes sense. It looks like she has a left pneumothorax. We need to get set up for a chest test. Brittany, how you doing? Breath tube, okay. And we'll also need the C-spine zone.
I'm gonna raise the bed up.
What size tube do you want, doctor?
I think we need to run it down here.
Yep.
There you go. There's your marker. Chelsea, get a C-spine technique set up, please. Could you back it up a little bit? Thank you.
Brittany, is there any way for you to just bring your shoulders down a little bit? Good. We're just gonna take a picture of your neck here, okay?
Could you get that marker in there a
Yep.
little closer? Okay. All right, x-ray.
X-ray. Beep.
Okay, you want to come peek?
It looks like we have a C2 fracture. Can someone get neurosurgery on the line? Can we page neurosurgery? Let's go ahead and do another set of vitals. And get set up for the chest tube. Alright, thank you. We'll run down the surgery.
Chelsea,
Thank
can
you.
bring that back for me, please?
Thank you, Brittany. Okay. This is gonna happen real fast, okay? Okay. Alright, we're gonna get set up to put a chest tube in on this side to help with your breathing.
Grab the grid and
Got that?
you can get us out.
How did you like the video? What did you like the most? Why? What did you like the least? Would you not like to do that? Does this career still interest you? Can you see yourself working in these situations? If yes, this very well may be the career for you. Questions, comments, or concerns? I would love to hear from you. My email is mnoble@autrytech.edu. If you haven't done so, please get your applications completed and turned in. The next step is the interview. These are tentatively scheduled for June 26th. Again, do not hesitate to contact me. I am here for you. Thank you, and I hope you have enjoyed your virtual observation day.